Your hands are probably steadier than mine.
Huh?
They are, probably.
My hand is okay.
Alright, good afternoon, everyone. When a person is diagnosed with a disease, it's often devastating. They often think, what could I have possibly done to have changed my diagnosis? With many diseases, such as cancer and stuff like that, there's many factors that play into this. A lot of it has to do with genetics. However, there are one specific set of diseases that you do have control over and that you can change. And these are known as sexually transmitted diseases. Sexually transmitted diseases are defined as any various of diseases that are usually contracted through sexual intercourse or other intimate sexual contact. The CDC has estimated that approximately each year there are 19 million new sexually transmitted diseases diagnosed. Sexually transmitted diseases are continually on the rise, and it has become a hidden epidemic. I firmly believe that the number one thing that we can do as to the public to prevent this is education. It's very important to get educated on the names and what causes it, which would be the etiology, what signs and symptoms there are, what each person should look for in themselves and even their partner, and the statistics or the epidemiology of how widely known these diseases are and how many people are affected. Also, it's important to know what the treatments are, and with some diseases there are treatments, and with some there's just management based. So what can you do to help? You can listen today to my speech, and you can educate your peers on this awful process that we have going on, because knowledge is power. The first disease is chlamydia. It is chlamydia trachomatis, and it is a bacterial infection that is found in bodily fluids. Another one is gonorrhea, which is Neisseria gonorrhea. It is also a bacterial infection. Syphilis is Tribonium pallidum, and it is also a bacterial infection. Herpes simplex virus, there is herpes simplex virus 1 and herpes simplex virus 2. These are viral in nature. There's also human immunodeficiency virus known as HIV-1 and HIV-2. They're also viral in nature. And human papillomavirus, which is HPV. And there's over 70 strains of this virus present. Trichomonas is Trichomonas vaginalis. It is a protozoan infection that is in bodily fluids. Why is the transmission so high? You often think to yourself, how could a person pass these diseases on knowing that they have this? A lot of times people don't know that they have it, or they're not educated enough to realize that their symptoms that they're having are not normal. Many people often confuse signs and symptoms of STDs with daily illnesses. Identifying the infection is key to disease transmission and decreasing passing from one person to the next. With chlamydia, it is often asymptomatic. However, if there are symptoms, there is, in the females, they often have a yellowish-green discharge, vaginal swelling, sometimes even some light vaginal bleeding, not around their menstrual cycle time. With males, there's frequent dysuria, which is burning with urination. There's often a yellow or green discharge and itching present. Females are usually more symptomatic than males are, so many times males do not know that they've been affected, and so if they have multiple partners, they pass it on from person to person not knowing. Gonorrhea, there's often purulent drainage, painful urination. In females, you often see vaginal bleeding, and sometimes there's even skin lesions. Females are more frequently symptomatic than the males are in this case also. Syphilis is a painless sores at the site of transmission, with the site of transmission being it could be orally, vaginally, or anal. There's also enlarged painless regional lymph nodes. That's just the region that's affected. The lymph nodes are swelling. So you could have swelling and pain in the growing areas or in the throat. Herpes simplex virus is classified as vascular lesions with a red base. There's painful and lymph swelling. They're often through different stages of healing. There will be vesicles or bubble-like blisters. They often, throughout their treatment process, they become into scabs and drain and have fluid filled. Human immunodeficiency syndrome, there is often, it may cause different brief mild illnesses. So often it's not, there are many people that are infected that don't know it. They'll have fever for several weeks, even night sweats, explained weight loss, diarrhea, difficulty swallowing, vision, and memory problems. So you can see how this is often can be confused as the common cold, the flu, things like that. Human papillomavirus, it's very hard to identify because there are over 70 strains of it. They're frequently often asymptomatic. There are a few strains that cause genital warts, and that's the one that's seen more common with knowing that they have symptoms. Most of the time, it's just it just affects the cervical or the penile or the anus cavities, and this is where you usually find cancer. Trichomonas is often asymptomatic, but in women there's vaginal itching, a frothy, foamy discharge that often smells very fishy. With men, there's pain and burning and discharge from the penis. Many people in Louisiana are affected by STDs. The actual number is extremely shocking. In 2009, Louisiana had 626.4 per 100,000 cases of chlamydia, which is 1.5 times higher than the national average. Louisiana was the third highest in the United States. On gonorrhea in 2008, Louisiana had a 204.0 per 100,000 people affected. This is twice as high as the national average. Louisiana was the second highest in the United States for this. Syphilis in 2009 had an average of 16.8 per 100,000 people affected. This was the highest rate in the United States, and this is 4 times higher than the entire country. Herpes simplex, it's very difficult to identify the total cases due to the reports, and there's not as much reported to the Centers for Disease Control, and people are often unaware. There's approximately estimated there's 50 million people ages 12 and older that are affected by herpes simplex virus, and 90% are often unaware and asymptomatic with this. They may live their entire lives and never even know it. HIV, in 2009, there was 17,155 infected people in the state of Louisiana. 19.4 per 100,000 were affected in Louisiana that were living with the actual AIDS diagnosis. But however, we were below the New York average, which was 135,018 persons living with the HIV/AIDS infection. This disease is often not reported enough due to the fact that people don't know that they have it. There's often times that they have had the disease for multiple years and are unaware because of its lack of total symptoms. Human papillomavirus, it's estimated that there are 20 million people infected with HPV in the United States. There are 6 million new infections each year. 50% of sexually active people, men and women, will become infected with this throughout their lifetime. 1% of the sexual active adults do have genital warts, and 12,000 women get cervical cancer in the United States that are due to human papillomavirus. Trichomonas, estimated there's 3.7 million people that are affected with this. It's more common in men than women, and it's also more common in the older age women than it is in the younger age. So it's frequently more common for a 40 to 50-year-old to have trichomonas than it would be to a 20-year-old. How can we fix this? In today's society, we're often involved in our healthcare plans, and we want to know what we can do to stop this, prevent it, or treat it. From diseases to cancer to STDs, people want to know what they can do to fix it. So how can you rid this disease? With bacterial infections, there's often cures. With viral infection, there is no cure. The only step is symptom management. With chlamydia, azithromycin, which is Zinthromax, is given 1 gram orally in 1 single dose, or doxycycline 100 milligrams orally twice a day for 7 days. And abstinence from sexual intercourse after the completion of medications is often requested. Gonorrhea is ceftriaxone, which is Rocephin. It's 250 milligrams given in a 1 single intramuscular dose. They can often take Suprax 400 milligrams orally in a single dose. And abstinence from sexual intercourse is encouraged after the completion of the medication for at least 7 days. With syphilis, penicillin or Bacillin LA 2.1 million units is given for adults in a 1 single dose injection. Also, if they were allergic to penicillin, Zinthromax 2 grams orally times 1 dose is given. And then, of course, abstinence from sexual intercourse for at least 7 days is told to do. Herpes simplex virus, there is no cure for it. You can often just treat the symptoms and the outbreaks. If a patient has more frequent outbreaks, they usually can put them on a daily dose of medication that will prevent the occurrence of outbreaks. For the initial infection, acyclovir 400 milligrams is given 3 times a day for 7 to 10 days, or vanciclovir, which is 1 gram by mouth twice a day for 7 to 10 days. For recurrent outbreaks, acyclovir 400 milligrams is given by mouth once a day, or the vanciclovir 500 milligrams by mouth just once a day. And no sexual activity is to be done during the period of outbreaks, because this is when the disease is transmitted from person to person. HIV, there is a large number of pills that are taken for this. It's known as antiretroviral therapy. The therapy is recommended for patients depending on their amount of their CD4 count cells and how high the virus is in their system at the time, and the medications are adjusted. There are many, many medicines that they take every day for this. But ART is a combination of at least 3 drugs. Some of these drugs are Combivir, Kaletra, Elliptal. So it's just depending on the medication that the doctor prescribes and the medication that's working best for them. With human papillomavirus, there is no cure. There is over 70 types of strains. Many don't show symptoms, so many are just treatments of things that could come up, such as cancers. But for genital warts, there are medications that can be given. And they can also use cryotherapy. That's where they actually freeze the warts off and they remove them. However, there is a vaccine known as Gardasil that's a 0.5 ml intramuscular injection that's given to protect against the HPV viruses of 6, 11, 16, and 18. And these are the most common causes of cervical cancer. Both women and men can be given this to reduce their transmissions to partners. Trichomonas, a flagyl pill, 2 grams orally in a single dose is the first-line treatment. However, Tentamax, 2 grams orally, can be given in a single dose. Another optional is a metronidazole, 500 milligrams. It's given twice a day for 7 days. Abstinence for 7 days is recommended after the initial treatment. The general rule of treatments, rescreening is often encouraged every 3 to 6 months after the diagnosis of the disease. And it's often important that you have your partner checked and your partner treated as well. Despite the increase in research and reporting to the CDC, there's still a large amount of STDs in the United States that are diagnosed each year. Education to all ages is very important. It's very important that you educate your partner, you educate your friends, and make everyone aware, because education is where we can start to prevent the spread of diseases. What to remember: make sure that you're aware of the names, that you are not confused, and that you know what causes what and what's bacterial, what's viral, what can be cured and what can't be cured. Knowing the signs and symptoms, knowing if there's something wrong, when you need to go to the doctor, and also